Hello, I'm Amy Hoey. I'm the Senior Vice President of Patient Care and Chief Nursing Officer for Lowell General Hospital. And today I'm thrilled to share with you a tour through our new Dahod Building at Lowell General Hospital's main campus. The Dahod Building is a 200,000 square foot, 6-story building that really functions for us as a partial replacement hospital. Most of the patients and families coming to the main campus are able to experience this new beautiful building. Please join us as we take a tour of the new Lowell General Hospital and our Dahod Building. We're here in the gorgeous main lobby of our Dahod Building, where you can see a couple of the important goals of the project were accomplished. One of those goals was to put elevators as close to the main entrance as possible so that patients and families could easily find their way throughout Lowell General Hospital. A second goal was to make sure that we had outpatient services as close to the main entrance as possible. We were able to achieve that through the use of our brand new patient service center, as you'll see. Patient Service Center, easily accessed from our main lobby, patients and families are able to take advantage of a wide array of services, such as pre-admission testing, our cast room, laboratory, and imaging services. One of the features of the Dahod Building is our brand new 50-bay Hanson Family Emergency Department and Trauma Center. We'd like to take you inside and show you some of the features of the state-of-the-art department. The Hanson Family Emergency Department is a 50-bay, all-private room ED and trauma center. There are 6 team centers to adapt to the varying needs of our patients depending on the acuity with which they present. I'd like to introduce our Nursing Director for Emergency Services, Diane Regan. Diane's going to share with us some of the special features of this state-of-the-art department.
And we'll take you on a walking tour through the emergency department, and we can show you some of the team centers and the types of patients that we care for in each team center. I'm standing here in one of our 2 trauma bays that are brand new with our state-of-the-art emergency department. We have a level 3 trauma center, and we care for the sickest of patients right within these 2 rooms. As you can see, we have what we call booms that are really have everything that you would need to care for the patient: oxygen, suction, vacuum, monitoring, cardiac monitoring capabilities, as well as lighting to make sure that we have good views for the patient, and then everything else in the room to care for our sickest patients. We have access to ultrasound emergency equipment, and we also have access to PACS viewing stations so that the provider and the trauma surgeon can be reviewing all of the x-rays and films that are done. This is one of the 2 rooms that we have. The rooms are both connected to each other by way of a door so that the surgeon could be able to go back and forth if needed from one room to another. And we also have a PICSA station, medication room, that's attached directly to the trauma bays. And so we have this all right at the fingertips of all the healthcare providers. So it's very exciting to be able to service these patients so quickly in our emergency department. And within one of these rooms, we will either transfer them to a tertiary care center expeditiously, or we'll care for them within the Lowell General Hospital. So I'm going to take you into one of our 50 private rooms that we have. And this room was really designed with all of the patient and the caregiver in mind. As you walk through the room, you can see that we have a caregiver side and we have a family side. And as we're going through the room, everything is set up really so that everything is at the provider's fingertips so that they can care for a patient. Between the monitoring equipment, all of the oxygen, suction, vacuum, and then we also have a cart in each room with all of the common supplies for caring for the patient. Many of our rooms have cardiac monitoring equipment, and what's nice about the monitoring equipment is we can actually trend the vital signs from the equipment right into our electronic medical record. So that is definitely an enhancement in how we care for patients and seamlessly flow the information to the patient's medical record.
Kim was just telling me that she's been a patient with us many times before, and she was really curious about how we went about designing this beautiful building.
Oh, absolutely. So we really had a lot of involvement from staff when we were designing the rooms. We had mock-up rooms. We had invited all of staff members to come and really look at how we flow patients through the emergency department and all of our typical care rooms. So we had a lot of staff involvement and really with the patient at the center in mind.
Hi, my name is Rosemary Cannaville and I work at Lowell General. I'm a CAT scan technologist. I've been here for 30 years. I just want to explain to you a little bit about our CAT scan machine. It's a 128 slice scanner. It does cross-sectional pictures, so you can see everything from an axial view to like sideways views of the patient. So if I can show you over here, I can show you a head CT if you ever get into the emergency room. We can do cross-sectional pictures of your head, and we can look for any abnormalities. Here's actually a side view of a patient. And then if I go over here, I can exactly show you what a cross-sectional picture looks like. And you can see parts of the brain, structures that you can see without having you go through any surgery. So the radiologist will interpret this, and the doctor will give you the results of the scan. So here you are seeing the patient's eyes and the ventricles of the brain, and this is all the soft tissue of the brain. And then we can take this image and we can reconstruct it, as I was explaining earlier, to a coronal view, and you can actually see a front view of your head without radiating you at all. We also, with this machine, is wonderful, is we have dose right, so it actually measures the dose of radiation to your body. So it will measure your body and it will actually reduce the rate of radiation dose to you. So you're not getting a full view of radiation through your body. We do practice image gently protocol here at this hospital, and we take radiation safety extremely seriously. So here we're doing an abdominal CAT scan, and this patient we're looking to see if they have kidney stones. And you can see the patient's kidneys here, and here is the liver and the spleen. And we just basically cross-sectional it all the way through so we can get to see what's going on with the patient.
As a level 3 trauma center, the helipad has really transformed transport of the critically injured patients out of the city of Lowell. Our heated walkway brings patients by stretcher straight from the emergency department to the heated helipad for transports out. Here on the basement level of our Dahod building, we have a brand new same-day surgery unit and 3 new operating rooms. I'd like to introduce Clinical Manager Karen McGarty, who's going to tell us a little bit about the John Tebow and Elaine Zuzas Surgery Daycare Center.
Hi, thank you for coming. Here on the Same Day Surgery Center, we have 26 private bays to help take care of patients and families. We have many different services that we provide, and if you come with me, we'll take you for a tour.
Now we're inside our 26-bay same-day surgery unit, which supports our 13 ORs, including 3 brand new orthopedic suites. I'd like to ask Karen to describe for you some of the features of our bays.
Okay, thank you. This is inside one of our private bays. The patients and the families will check in here in the morning. They'll be admitted by one of the nurses. They're on the same level as the ORs, and they have easy access to the anesthesiologist and the doctors performing their surgery. We've got all state-of-the-art equipment to help monitor their vital signs. We've got televisions to help them keep occupied during their stay. And if they have any questions, the nurse's station is right out there.
One of the ways we've really been able to leverage technology to create complete connected care is through the use of a robust electronic medical record. Our patient record is Cerner's Millennium system. We use this system across all of our campuses to provide the most up-to-date clinical care to our patients and to put information at the fingertips of all of our caregivers. The fifth floor of the Dahod Building features our beautiful labor and delivery unit. The labor and delivery unit has 12 labor and delivery rooms, similar to the room I'm standing in right now, as well as 2 surgical suites. All of our labor and delivery suites are characterized by 3 main sections: a caregiver zone, a family zone, and an infant resuscitation area. During the design of this project, we got input from all of our clinicians, doctors, nurses, as well as family members as to the features that they would most like to see in a brand new suite. I'd like to ask registered nurse Patty Murray to describe for you our infant resuscitation area.
So when the baby is born, it's our goal to keep the mom and baby together if that's possible. So you'll have the baby nurse that will come into the room, get some warm blankets, and be right at the bedside with you. And as long as everything's fine, when the baby is born, the baby's going to go right up onto the mom, and we'll stay with the mom until such time as the mom wants the baby to be dried off and cleaned up. This is our resuscitation area for the infants because there are times when the baby does need to come over here. We have a special care nursery team that comes to some of our deliveries based on certain factors with the labor. When the baby comes to the crib, there's a radiant warmer, and there's a monitor that will go right on the baby to regulate the baby's temperature. We have oxygen equipment, air, some suction, everything that you would need just to keep the baby stable.
Here on D3, one of our 2 brand new 30-bed all-private room inpatient units. D3 has a surgical focus, and our other 30-bed all-private room unit, D4, has an IMC level of care focus, or intermediate cardiac care. Here on D3, as in all of our other clinical spaces, we have a caregiver zone and a family zone that's designed to meet the unique needs of those populations so that we can do our very best providing complete connected care to our patients and families. One of the things that as nurses we love are these distributed head walls so that we're able to access clinical supplies such as oxygen and suction from either side of the bed without needing to reach over the head of the patient. Previously, we would have to often reach over the head of the patient to access the call light or other such supportive measures. The Skylight patient information system can be easily accessed by patients and families right from the bedside using their remote control. Now I'd like to ask Melissa Silva, Clinical Manager for D3, to talk to us about our Patient and Family Information Board. Melissa?
Hi, this is our information board. They're in all of our patient rooms. We use these boards to function from shift to shift. We ask the patient what their preferred name is, and we make sure all staff are aware of that. And then we make sure they know who's caring for them for that shift. The physician, the nurse, and the aide as well. We also like to focus on what the patient's goal is for that day and what their biggest concerns are. And as you can see, pain is a big focus here, especially on our surgical unit, and it's something that we address each and every time we enter the room. All of our 30 private patient rooms are equipped with a fully functioning bathroom. They all have their own shower, and we really focused on patient safety. The bathrooms all have safety bars to make sure the patients can ambulate and move easily.
Thank Thank you for joining us on our tour of the Dahod Building. We strongly believe that our patients need and deserve a peaceful, caring, healing environment and staff who are fully engaged in coordinating every facet of their care and anticipating their every need. For more information or to contact us, please visit our website at lowellgeneral.org. Lowell General Hospital. We're always here when you need us.